There's good news for anyone suffering from tooth loss. There is an option out there that will allow you to get replacements that look, feel, and function like the real thing. And here to tell us about the benefits of dental implants is Dr. Matthew Nawrocki with the Jacksonville Dental Specialists. As always, we appreciate you being here. Okay, so what happens if someone is watching right now and they, have to get several teeth replaced for whatever reason, and they don't do it? That's a problem.
It is. It causes a lot of negative outcomes, and so probably the most obvious thing that happens is someone loses the ability to eat certain foods, meats, bagels, fruits, vegetables, things like that. And that, other than the enjoyment factor, that also leads to a decrease in their health. It takes their well-being down. It also impacts their speech. We use our teeth and our lips and our tongue to speak. And so if you alter that, it causes problems. And then obviously it's aesthetically, it can cause embarrassment, insecurities, low self-esteem. So all these negative things happen. You also get a biologic change. Once you lose a tooth, the jawbones go away. That's one of their only reasons for being around, is to hold teeth. So if you don't put something back in like an implant, you get a bone loss, you get a sunken in look to your face, and it's very aging. It's, like the picture shows here, you get this kind of old maid looking
it's
thing.
a precipitous decline that starts with just one tooth.
It does, it does. One tooth goes away, you lose some bone, it starts cycling to other teeth, and before you know it, you're missing your back teeth. Now you're missing your front teeth because they're breaking down. So it does start this whole sequelae of negative outcomes. And so
what do we do? How do we fix it?
There's different options, but nowadays one of the best things we have are dental implants. So whether you're missing one tooth, several teeth, a full set of teeth, or indentures, implants can oftentimes help. And it's important to understand what exactly an implant is. We often use the term implants to be all-encompassing, but there's really three big components. And
we're looking at kind of a graphic there to help the viewers at home kind of walk through it.
Exactly. So the implant itself is actually the replacement of the tooth root. It goes into the bone. It fuses with the bone through a process called osseointegration, and it's a titanium replacement for a root. Then you have the tooth or the crown that we see and that we eat with, and then there's a third component called an abutment, and that connects the implant to the crown. So there's really more than just an implant. It's really at least a three-component system to be aware of, when you start talking about this.
And this is for replacing one tooth, multiple teeth across the board? What's the process?
So an implant or implants can be used for one tooth, many teeth, stabilizing dentures, replacing all the teeth in a permanent solution. And that kind of gives you, the diagram kind of gives you a gambit across the board there, whether you're missing one tooth. As you're missing more than one tooth, the number of implants to replace, the number of teeth actually goes down. So you don't necessarily do one implant per tooth. That also increases cost effectiveness and all these kinds of things. So one tooth, one implant. 3 teeth, 2 implants.
Okay. Yeah. Okay. So you're getting more bang for your buck, is what you're saying. You're getting more of a deal. What about pain? Because I'm a little bit of a wimp. Would that sort of thing be painful?
Removing a tooth is oftentimes more uncomfortable than putting an implant in. You don't really have nerve innervation in the bones per se. It's in the gums, it's around the tooth. So if you ever had a tooth taken out, you did more or less okay with that. The implant's probably less of a discomfort than that. It's minimal to moderate at most, and there is medication and techniques you can use to minimize that.
Yeah, good. Yeah, I know those techniques. Those are good techniques.
So sedation, being numb, of course, all those kinds of things.
Sedation, that's good. Forget about it. Okay.
You just forget about it and it's done.
All right. What about insurance? Because I know that's a big question nowadays, especially, is my insurance going to cover something like this?
And so everyone's policy and coverage is different, even within the same company. So call your insurance company, see if they have implant coverage. Some implant
those are the buzzwords that you need to use.
Yes.
Implant coverage.
Do you cover? Does my policy?
Well, wait. Make sure we say which kind of implants.
Does my exactly dental implants? So
okay, dental implants. All right.
Does my dental
policy? Making sure you're paying attention. Okay. All right. Keep going.
Does my dental policy cover dental implants?
Got it.
Some policies have what's called a missing tooth clause, meaning they won't replace it. That's important to know so that you have all your ducks in a row going forward and you're planning financially for this endeavor. But call them and ask them. We'll do everything we can to advocate and maximize your benefits. Even if the implant itself is not covered, there's oftentimes ways to get the other procedures covered so you still end up maxing out your benefits. We're trying to advocate for you on something you're paying for.
Sure, and something that's life-changing for a lot of people.
Absolutely.
Listen, so if there's somebody who's watching at home right now and they want to come in and ask you a bunch of questions, maybe it's about the insurance, maybe it's about the procedure itself, maybe it's about something aesthetic and it has nothing to do with functionality, they can do so because you guys hold monthly free seminars.
We do. One thing we do once a month is we offer free seminars going over whether you're missing a tooth, a bunch of teeth, a couple of teeth, all your tooth replacement options. We try to give you a whole gambit there, and our next one is next Wednesday at 6:30 at our Southside location. So you can call or visit our website and set up that, or if you want to go straight to consultation, you can let us know as well.
Do that as well.
Yeah.
All right. Well, thank you so much. We appreciate you, Dr.
Yeah.
Nawrocki, as always, coming in, and thanks to you guys for making this possible, and thanks to Jacksonville Dental Specialists for coming on. 904-460-4201 is the number to schedule a consultation. You can also go to their website and learn more. It's jacksonvilledentalspecialists.com.